Good afternoon. Welcome to the Assembly Committee on Health and Human Services, to everyone here in Carson City, everyone in Las Vegas who's joining us, and everyone online. Secretary, will you please call roll?
Assembly members Dahlia. Here. Edgeworth. Present. Gonzalez. Here. Goulding. Here. Gray. Here. Hafen. Hibbets. Here. Hunt. Here. Jackson. Here. Koenig. Nadeem. Wynn. Here. Orentlicker. Here. Chair Brown-May.
Here. Thank you. Would you please mark our members present as they arrive or absent excused? If they don't make it, we do have a number of members that are traveling. Specifically, Assemblymember Hafen absent excused today. All right, members, we have a number of items. Before we begin, let's start with some housekeeping. Reminder, please silence your electronic devices. If you wish to testify, sign in at the table by the door, provide a business card to our committee secretary. And then when you do testify, please remember to turn on your microphone and clearly state and spell your name for the record. Members of the public may provide testimony on a bill either in person or by telephone. To do so, you will dial 888-475-4499 and then enter the meeting ID today, which is 898-1492-8868, and then press the pound sign. Our meeting agenda and committee information is available on Nellis, which can be accessed through the legislature's website or through our YouTube channel. Thank you for those of you who are joining us on YouTube. Public comment will be taken today at the end of the meeting. Each person will be limited to 2 minutes, and as a reminder, we expect courtesy and respect in all of our interactions. We ask that you keep your comments relative to issues that are addressed in Health and Human Services, as that is the committee's jurisdiction. And committee members will be using their laptops or other electronic devices. Please don't take that as a sign of disrespect. They have a number of items that they're looking at online in support of our meeting materials. We do have a number of items on our agenda today. So members, since we are here, we are going to start with our work session. So we have a work session on 4 items on our agenda today. And we'll start with the first bill number, Assembly Bill 19.
Thank you, Madam Chair. Davis Florence, Committee Policy Analyst for the record. And before we begin, I want to remind the committee that as nonpartisan staff, I can neither support nor oppose any of the measures that are before you today. You should have a physical copy of the work session document in front of you. And then starting with Assembly Bill 19, which revises provisions relating to the statewide Substance Use Response Working Group. This was sponsored by the committee on behalf of the Attorney General and was heard on February 17th. AB 19 expands the membership of SURGE by adding the Executive Director of the Department of Indigent Defense Services and the following 4 members that are appointed by the Attorney General. First is a member of the general public, an emergency response employee, a representative of the Division of Child and Family Services, and a representative of the Nevada District Attorneys Association. The Office of the Attorney General has submitted the attached proposed amendment to revise the SURGE membership additionally in Section 1 by adding that the designee of the Director of DHHS will be a member or a employee of the Division of Public and Behavioral Health. And then second is adding a preference for the member of the general public to be someone who is bilingual and resides in a bilingual household. I'll turn that back to the chair. Thank you.
Thank you, Mr. Florence. Members, are there any questions on this measure? Seeing none, I will entertain a motion to do pass Assembly Bill 19.
Move to amend and do pass.
Thank you. Vice Chair Wynn, amend and do pass. Second by Assemblymember Gonzalez. All those in favor, please say aye. Aye. Any opposed? Nay. Can I have the nays? Do you mind raise your hand? Nay from Assemblymember Hibbets. And nay from Assemblymember Gray. Motion does pass. Is there a discussion on this motion?
Thank you, Chair. I was speaking with the Attorney General earlier to let him know about my position, and just for the record, it simply because I don't agree with expanding boards and making it an even number, and I'm committed to working with the Attorney General to see if we can come to a compromise on this.
Thank you. Assemblymember Gray.
Yeah, Madam Chair, as a member of that board, I don't agree with making it any larger either. It's already a pretty darn big board. I would like to actually see some of the positions redesignated. I think they want to put some very valuable members on there, but I think that it needs to be done a different way.
Thank you for your comments. Anyone else? Okay, motion carried. We'll assign that floor statement to Vice Chair Nguyen. Okay, members, next on our agenda is Assembly Bill 31, providing for certain Medicaid reimbursement of providers of non-emergency secure behavioral health transport. We'll turn this over to our committee policy analyst, Mr. Florence.
Thank you, Madam Chair. Davis Florence, Committee Policy Analyst for the record. Assembly Bill 31 provides for certain Medicaid reimbursement of providers of non-emergency secure behavioral health transport services. This was sponsored by the committee on behalf of the Southern Regional Behavioral Health Policy Board and was heard on February 19th. AB 31 requires the Director of DHHS to include under Medicaid a requirement that providers of non-emergency secure behavioral health transport services be reimbursed for the distance traveled to pick up a patient and the distance traveled after the patient has been dropped off. Additionally, this bill requires the Director to submit a request to amend the state plan to increase the reimbursement rate for these services by at least 15% when the patient's pickup, drop-off, or both occur in a county whose population is less than 100,000 and at least 10% for all other services. There was an amendment submitted by Mark Funkhauser, the coordinator of the board, which proposes to move the effective date back to January 1st, 2026. Thank you, Chair.
Thank you. Members, any questions? Seeing none, I'll entertain a motion to amend and do pass. So moved by Assemblymember Gray, second by Assemblymember Nguyen. Any discussion on this motion? Seeing none, all those in favor say aye. Aye. Any opposed? Motion carries unanimously. We'll assign the floor statement to Assemblymember Gray. Next up, we have Assembly Bill 60, revising provisions relating to certain behavioral health services. We'll turn this over to Mr. Florence.
Thank you, Chair. Davis Florence, Committee Policy Analyst for the record. Assembly Bill 60 revises provisions relating to certain behavioral health services. It was sponsored by the committee on behalf of the Northern Regional Behavioral Health Policy Board and was heard on February 19th. AB 60 requires the certification of prevention specialists by the Nevada Certification Board and requires them to plan and implement evidence-based programs and other evidence-based interventions in schools or communities to address substance use or other behavioral health disorders. Substance use disorder prevention coalitions must employ or contract with certified prevention specialists as necessary to perform the duties of the coalition. Additionally, this bill requires an individual to be at least 18 years old to be certified as a peer recovery support specialist and to allow minors who are at least 16 years of age to serve as peer recovery support specialist interns if the board has established the necessary conditions. There was an amendment submitted by Sherilyn Rar-Wood, the coordinator of the board, that proposes to revise in Section 1 the definition of certified prevention specialists and removes throughout the bill the provisions allowing a minor to use the title of peer recovery support specialist interns. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions on this measure? No questions. I will entertain a motion to amend and do pass.
So move.
So-
Amend and do pass.
So moved by Assemblymember Nguyen, Vice Chair Nguyen. Second?
Second.
Assemblymember Gonzalez. All those in favor, is there any discussion on this motion? No, all those in favor say aye.
Aye.
Any opposed? Hearing none, motion passes unanimously. We'll give the floor statement to Assemblymember Gonzalez.
Thank you, Chair.
Thank you. Next, we have Assembly Bill 102. We'll turn this over to Mr. Florence.
Thank you, Chair Davis Florence, Committee Policy Analyst. For the record, Assembly Bill 102 revises provisions relating to emergency medical services. This was sponsored by the committee on behalf of the Joint Interim Standing Committee on Health and Human Services and was heard on February 28th. AB 102 authorizes the District Board of Health in a health district that includes a county with a population of 100,000 or more, but less than 700,000 to elect, by an affirmative vote of the majority of all members, to regulate emergency medical services. This bill also lowers the minimum age for licensure of an ambulance attendant, EMTs, advanced EMTs, or paramedics from 18 to 16 years of age. Lastly, AB 102 removes the requirement for licensure as an ambulance attendant if the individual is solely participating in a training program for certification as an EMT, advanced EMT, or paramedic and does not provide care to a sick or injured person or drive the ambulance. There was an amendment submitted by the Nevada Fire Chiefs Association, which proposes to exempt a county with a population of 100,000 or more, but less than 700,000, that elects to regulate emergency medical services from also regulating centers for the treatment of trauma. Thank you, Chair.
Thank you, Mr. Florence. Members, are there any questions? Okay, seeing no questions, I'll entertain a motion to amend and do pass. By Assemblymember Gray, motions. Wow, that was a lot of seconds. I'll go Assemblymember Gonzalez, second. Any discussion on this motion? Do you have a discussion?
Yeah, this is a great rework. I just want to say this was a great rework of a bill that I brought last session, and the committee, the Interim Health and Human Services Committee, did a good job, and everybody came to the table with their amendments, and it was a good group.
Thank you, Assemblymember Gray. Any other discussion on this? All those in favor, please say aye. Aye. Any opposed, nay. Motion carries unanimous. We'll assign the floor statement to Assemblymember Goulding. That concludes our work session for today. Thank you, members, for being here and being prompt. We will move right into our agenda items. Our first bill hearing, Assembly Bill 368, revises provisions governing electronic communication devices in certain healthcare facilities. We will welcome our Assemblymember Carter and his team to the table. I would ask you to please try to keep your presentation to within the 15-minute time limit. And then should we have support, opposition, and neutral, we will limit to 20 minutes in each so that we can expedite our work today. Assemblymember Carter, you are welcome to begin.
Thank you very much. Good afternoon, Chair Brown-May, Vice Chair Wynn, and committee members. I'm Max Carter, Assembly District 12 in down in Clark County, the east side of Las Vegas. And today I'm bringing before you Assembly Bill 368. This important bill is about expanding the scope of AB 202 that was approved, that made it into law last session, that allowed electronic communication devices, i.e. cameras, to be put in the private areas of one's loved one's area within a skilled nursing facility, i.e. their bed. And a lot of controls around it that are appropriate. And this is looking to expand that. And this, I just want to say that this is one of those bills that I think we all as legislators hope to get. You know, sitting beside me is
Peggy Stevenson.
the last name. Yeah. We were working on, excuse me, I won't go into that. Peggy Stevenson and Mike Stevenson. Down south is Jody, and I forgot, Jody will correct me, and her son Andre. All of them are constituents. Peggy and Mike of me. Myself, I believe that Jody and Andre live on the other side of town, but this is a bill that was brought by constituents that are looking to change things for the better. And with that being said, I'm going to turn it over now to Peggy Stevenson.
Hi, I'm Peggy Stevenson, P-E-G-G-Y-S-T-E-P-H-E-N-S-O-N. I'm here because my mom and dad were good role models, and they would be here if they could. AB 202 was a start, but it was narrowly written for skilled nursing, as Max said. Skilled nursing doesn't have the corner on abuse and neglect of our loved ones who need extra care. This past Veterans Day, I went to the Boulder City VA home where Governor Lombardo was speaking and honoring all of those who have served. It was there that I went to him to tell him about the long, hard road that we've traveled and that AB 202 needed to be expanded. He listened. He told me to get together with my legislator and he would sign it. And that's what I did. And so thank you, Max, and thank you all of you who are listening and hopefully supporting this. My mom is a survivor of many things. Now it's only the lines on her face that can tell her story of her life and the past 6 years. But my husband and I are here to tell you more. My mom was born in Munich in 1930, Munich, Germany, and she was a child under Hitler, and she survived many things. 70 years ago, this is Mom and Dad. They were a love story, and they met during the Korean War when Dad was stationed in Munich, and they got married and moved back to New York, where Dad was from. Mom was naturalized in 1969. They were both good people who lived by the golden rule. Dad worked and Mom pioneered the concept of group homes for the higher functioning people so they could enjoy more family atmosphere. Every weekend she'd bring someone home to spend the day with us, and I have fond memories of those times. They retired here in Las Vegas in 1991. My dad passed in 2009. When my mom was 85, she needed open heart surgery and she was left addled from the anesthesia. And details of everyday living were too complicated for her and was difficult for her to articulate her thoughts, but oftentimes it clicked. I've been her caregiver and advocate since then. Time passes and bodies decline and maybe add some elder dementia. I call Mom's 50% dementia. She's got great instincts, has appropriate responses. She knows what she's saying. We don't always understand it, but sometimes it clicks. She loves being in the mix of life. She's filled with love for everyone and animals. She knows who is bad. When we needed extra help, we looked only at A-rated facilities. It's been 6 years in 6 facilities. There's no hyperbole in any of this. It's Mom's story, but she's not the only one. In no particular order, she slept in the same soiled sheets for at least 2 days, was told to remove her wedding ring and mother's ring before she was showered, which was never returned, and of course the staff blames residents. Rooms are not regularly cleaned or maintained. Cold food was delivered in boxes to her room instead of community dining as promised for socialization. Irregular laundry service. Meds left in a cup for her to take on her own, which she needed help with. Knees and legs with broken skin, no wound care or explanation. Bad bruising on her wrists and forearms, torn skin. UTIs from having soiled pants on too long. Passing out in the shower multiple times. Reports of Mom's aggression towards staff, which leads to over-medicating and anxiety or sedation. You don't know what the truth is until you find out what the real truth is. And that's where our 36-hour days begin for us as advocates. We lobbied 4 times for cameras with a facility, ombudsman, and hospice. There were no policies, but the answer was no. But finally, one relented. And we put a camera in her studio and one in her bathroom. Camera signs were posted. That's where we began to see the real truth. Mom would be dragged by forearms quickly across her room at the employee's pace, not being respectful of her 92-year-old pace. That's where the bruising and the tears on her forearms came from. In the shower, she was ushered onto a cold fiberglass seat, and then the water was turned on and adjusted. Maybe. We all know it's cold to start out, and that's why Mom screamed and fought. The psychologist that we employed came in and explained that it was fight or flight, and that's why she kept passing out or fought. Mom had a stuffed dog that was her baby. She was in bed one day and she was tired and an employee wanted Mom out of the bed. She yanked the dog out of my mother's arm and said, "I'm going to put your dog in prison if you don't get out of bed." And Mom was crying for her baby. Another time, two staffers wanted her out of bed, and they were pulling at her arms and legs. And Mom repeatedly said, "Leave me alone." They got a third person to come in, and he went into Mom's refrigerator, where I had put some fresh strawberries and cream for her, which was one of her favorites. He took it out of the refrigerator, sat on what happened to be a new sofa that we put in there for her, and was taunting her, eating her strawberries and whipped cream and saying, "These are good. Come on over here, Inga." And then he proceeded to wipe his hands on the sofa and put back in the refrigerator. There was night staff that was supposed to make rounds every 2 hours to check and make sure that the residents hadn't fallen or gotten out of bed or, everything was okay. Never happened. We were not allowed staff scheduled to know who's helping Mom. Those were internal documents. But there was 24-hour visitation, and I was told I could find out myself, so that's what I did. 24 hours a day. I would come in different shifts to see who was there, and the people that were banned from taking care of her were indeed there. We weren't allowed Mom's staff log sheets, which are what they use to determine the level of care. I recorded abandonment of a 10-person unit for greater than 25 minutes. I was retaliated against for sharing evidence to the management. I had to remove cameras. They created a new policy, no cameras. It was a violation of a dressing room law. And they said Mom needed total lockdown, and it was $2,600 more a month. One place left her in her bed with rails up, shades down, all day like a mushroom. This is a picture of my mother on her 93rd birthday. The day before, we had gone to Chico's and she picked out her outfit. She was really excited about it. We had a big party with family and friends at the Hofbräu house for her, and she was having a great time working the crowds, and it was a great time. 2 weeks after that, she was abandoned in a common area where she was living, and the caregivers, the two assigned caregivers, weren't able to be found, were accounted for. She fell and wound up breaking her hip. And if we had cameras, we might have been able to call for help sooner. I want you to remember that this is only potentially going to help the people that have active advocates. The rest are all left behind, and it's only a snapshot in time that you get in their rooms. You have no idea what's going on elsewhere. We can watch our dogs live stream all day in doggy daycare with the comfort knowing that they're okay. We can watch our children in school all day knowing that they're okay and have some comfort in that. But why can't we watch our loved ones who depend on us? We have to live with the guilt of subjecting them to these places that are supposed to be A-rated. That's it.
Okay. My name is Mike Stevenson. All of my accounts are based on my personal observations. picture is worth 1,000 words. A live stream video gives a family 24/7 comfort that their vulnerable elderly loved one is safe and comfortable. There's nothing like seeing it live with your own eyes. Already in Nevada, there are cameras for people to view the legislator. Schools, buses, police officers, police stations, banks, stoplights, ATMs, airports, courtrooms, as my lovely wife said, child daycares, doggy daycares, the list goes on and on. But where you don't have cameras, even when you ask, and they don't have to let you, is nursing homes, assisted living, and all those other facilities that are called different things but are the same purpose. As Peggy stated, all the facilities we went to over this 6 years and 6 facilities were A-rated. And these A-rated facilities hired CNAs and caregivers. I'm going to focus on caregivers. And I know there are plenty of outstanding caregivers out there, but I'm going to focus on the dark side of caregivers. And in addition to caregivers, there's all kinds of medical professionals and titles. Some of them are RNs, LPNs, certified nursing agents, assistants or CNAs, medical assistant, med techs, nursing assistants, home health aides, personal care assistants, sitters, unlicensed assistants. But for caregivers, which are like the front lines, it requires 8 hours of training annually. And that 8 hours can be online. And as we all know, online training can be done by you, your friends and neighbors. It's open book, open Google, open everything. And online training has no practical application. So to become a caregiver, you don't have to demonstrate you can help move a person from a bed to a wheelchair, from a wheelchair to a toilet, from a wheelchair to a bathtub, from a wheelchair to a shower, from a wheelchair to a chair. Now, maybe they have those programs at these facilities, but there's no requirement. Also, there's no requirement to demonstrate you can help with feeding or hygiene. So, caregivers' qualifications, there's minimal education, minimal training, and oh, by the way, they're minimum wage. And they show up on a ward, and all of a sudden they're the king and queen of that ward because they determine when a patient eats, when they get their underwear changed, when they're allowed to go to the bathroom, when they have their sheets changed, when they're allowed to go to the common area, when their blinds are raised, when their windows are open, when they get dressed, when they get to brush their teeth, when they get to change their clothes, and they're minimum wage, minimal trained, minimal supervisors, and they're really not that well educated. So these caregivers, the frontline employees who protect our elderly, and we have cameras in the rooms, and we share that with management. And what does management do under AB 202? I'm not going to tell you. It's the FO word. They don't do anything. They say, oh, we won't assign them to your mother's room, their mother's cottage, but they still do. And you know what action what legal action is taken against them? Nothing, because AB 202 has no teeth. So, I ask you today, Peggy and I have gone down the path where we've shared video evidence with healthcare employees putting Inga in the shower and then turning the shower on and she gets cold water for 15 to 30 seconds. Is that torture? Why don't you try it yourself this afternoon or this evening? So, we ask you to look at 363 and protect our elderly. I'm sorry, 368, and allow cameras in all our healthcare facilities. Thank you.
Max Carter for the record, and I just want to say, first off, thank you to Colonel Michael Stevenson, that some of you active duty or retired up there understand, full bird colonel, and an SAS officer that's a tough man, and you see where this takes us. Family means everything to all of us. And I'm going to ask Jody down south to testify during public comment, Jody and Andre. But if, with your permission, I'll walk through the bill fairly quickly. Chairman?
Yes, but was your family down south prepared to be part of your presentation?
Yes, they are, but I'm trying to be respectful of the time. Jody is here to tell her story and Andre's story, and just trying to be respectful of the committee's time.
Thank you, Assemblyman Carter. I appreciate that. Given that you have a family that has been waiting, I'm happy to entertain that. You are welcome to come to the table.
Thank you so much. I appreciate that.
Good afternoon, now that it's noon, to the members. Thank you for letting me speak today. My name is Jody Collins. That's JodiCollins, and I'm here today with my son, Andre, Andre, also Collins. I support AB 368, allowing cameras in certain healthcare facilities. More specifically, I'm hoping that they will be allowed in supported living arrangements, because I am the son of Andre, who is now 29 years old. He has cerebral palsy, is profoundly deaf, and he uses an electronic wheelchair, as you can probably see. He moved into his own apartment last year with the assistance of Medicaid waivers through Desert Regional Center, or DRC. And he started living in our home, of course. In 2007, we moved into a house that had several cameras. So he's always been used to them being around. So when he moved into his own apartment, he wanted a camera and was told by DRC he could not have it because it was a rights restriction, meaning he was allowed to live in an apartment by himself without cameras watching him. So when I commented that it wasn't us who was asking for it, it was actually Andre, who went on Amazon and tried to buy one himself. I was told that we could not have the cameras because he had 24-hour caregivers, and it was a privacy violation. I believe that it is essential for the vulnerable population, such as my son, to have cameras. People with disabilities, the elderly, the nonverbal, and memory care individuals all are often unable to express when they are enduring physical, mental, or other kinds of abuse. There can be accusations made on either side, and I believe cameras would help to make those more clear and see what actually happened. I know this from experience, unfortunately, because when the caregivers were caring for my son at our own home, one of them fell asleep for 2 hours. My son was tapping him on the leg for several minutes, probably 5-10 minutes, and the gentleman never woke up. The care company asked me to look at the cameras and see how long he was actually asleep, and he had been asleep for 2 hours. That individual never worked with my son again, but like was mentioned before, he was just moved somewhere else. Again, when he moved into his apartment, a caregiver fell asleep for 6 hours, and my son woke up, climbed out of bed, and was sitting on the floor for several hours before I was able to contact that person. Again, like was said, she was moved from his apartment, but is still working in other facilities. The 1999 landmark Supreme Court case of Olmstead v. LC established that the least restrictive community integrated setting for those with disabilities is a right. And that is a right that my son had expressed to us several times, that he wanted to live on his own by himself in his own apartment. And so my husband and I let him, because that's what he wanted. But it's very scary to have him there and have things like we've noticed as well, bruising, scrapes, unknown injuries that nobody seems to know where they came from. So Andre being very adamant that he wanted to live alone and he wants cameras, and we're hoping that you will support this bill. Andre, who's already almost falling asleep because he just had his lunch, would also like to add, hopefully you'll be able to hear. Wake up, dude. What do you want to say? Your turn. Takes him a minute to type it in. Is your sound not up? Hang on. I saw you push it. Try again. Oh, it's connected to his hearing aids. I can hear it in his hearing aids. Uh-huh, I could hear it. I'm like, oh, you said it, dude. Sorry, buddy, you're hooked up. I'm sorry.
To provide context, existing law allow a patient in a skilled nursing facility or their representative to request the installation of an electronic communication device in their living quarters. If approved, the patient is responsible for choosing the device and paying the associated costs. This bill proposes to expand that to more than just skilled nursing facilities. Sections 3 through 6 define the healthcare facilities included in this bill. Most importantly, it defines facility for assisted living, which will be used throughout this bill. Sections 8 through 14 broaden the applicability of existing law to now apply to assisted living facilities instead of the narrowly defined in Nevada statute skilled nursing facilities for the purpose of installing electronic communication devices. It is important to note that the skilled nursing facilities are still included under the new definition. And members of the committee, we do have a conceptual amendment in to add in supported living arrangements, which includes what Andre lives in. And we are also working on a conceptual amendment that came from the Nevada Assisted Living Association, trying to make sure that we get this right on the definition of facilities. We're looking for the broadest, we're looking for a broad definition. We don't want to see it narrowed again. I would rather not have to come back again to tune this up. So we're looking at, in a nutshell, all types of assisted living, group homes, HIC homes, supported living arrangements, rehab facilities, and the like. So we're going to get that nailed down, and I'm not sure if the Nevada Assisted Living Association is here today, but they've been very good to work with, and I look forward to working through this with. And I'll just finish up by saying, we don't often get the chance to see who directly is affected by the work we do. You guys do right here, right now, sitting next to me and down in Las Vegas. And thank you very much, and we're ready for questions, Chair.
Thank you for your presentation. Before we begin with questions, Mr. and Mrs. Stevenson, Mr. Collins, and Mrs. Collins, I'd like to just thank you for taking your time and sharing your story and your vulnerability with us here today. That is the heart of what we do here in Health and Human Services, is care for all of our citizens. So thank you for having the courage to come forward and share your experiences. We do have a number of questions. Okay, we're going to start with Assemblymember Nadeem.
Thank you, Madam Chair. Thank you for the presentation. Listening to your story, my heart was really hurting. I was feeling the pain that you felt at that time, and I'm so sorry about that. So my question is that in the assisted living right now, as of now, there are absolutely no cameras, or there are cameras in the living room and the dining area, and there's absolutely no cameras anywhere in the facility?
Max Carter for the record. Right now, there's technically, it's up to the manager of the facilities. And you touched on a piece that we hope becomes a self-imposed regulation on the industry, you know, that like was alluded to, even elementary schools, daycare, even your doggy daycare typically has cameras with live feeds in the common areas. I'm hoping that we're not tackling that right now. I'm hoping that we never have to, because the industry understands that it's the right thing to do, just like what happened in daycare facilities and the like.
Thank you. Next question, Assemblymember Gonzalez.
Thank you so much. And Chair, I have two questions, if that's okay. Thank you. I do extend my heart out and sincerest sorries and apologies for what your family has gone through. It should not happen, period, to anyone. With that, I do have some technical questions. The report of the investigation, is that to be made to the public, the finding or anything posted anywhere? That if a facility, so in the bill, it talks about the investigation, if the facility is not complying, is that report to be made public? And for example, if I'm looking at places to put my family member in, would I be able to see that a facility was investigated for this, for not complying?
The extent of my knowledge for that, Peggy Stevenson, for the record. The extent of my knowledge for that is in the original bill, and I think it mentions that every 2 years, on odd years, I think it is, that do you want to take that over then? Okay. That the reports are compiled and they go somewhere, and they're for public consumption, but I have no idea how to get to them. And it's every 2 years, so, you know, if something happens during the off year, you have to wait another year before you even find out about that facility. And that's what I know.
Max Carter for the record. And yes, and I'll give you the standard legislator's answer to those type of questions. I will get that information to the committee as soon as I can.
I wonder if legal has a position or information to add relative to that?
Thank you, Chair. Yes, David Noss, LCB Legal, for the record. You see in Section 1, Subsection 1, Paragraph H, failure to comply with the provisions of NRS 449A.170 to 449A.192 are reasons for discipline. That clump does include the provisions that we're talking about, authorizing a person to put a camera into the facility for skilled nursing. Excuse me. And then subsection 4 of section 1 provides the report that is to be made to the director of the LCB about complaints maintained by the division. Hopefully that answers the question. Thank you, Chair.
Thank you. I appreciate the clarification. You have another follow-up?
Yeah, thank you. I'm just wondering if you would like to entertain maybe having that report somewhere else. Like you stated that the public can access that. Like I said, if I'm looking at potentially putting my loved one in a facility, I would like to be able to search as a regular person, not necessarily a legislator, to see if a facility was ever under investigation for not complying with the law.
Max Carter for the record. I'm looking forward to your amendment coming to my office. But yes, I would be happy to express that, and I'm not sure if Peggy wants to address it, but Max Carter for the record.
Peggy Stevenson, again for the record. Absolutely. I would love to be able to have that attached to the facility itself so that any reports or violations are part of their public record. Just doing a search, trying to find out more information about that particular facility.
Thank you. And then my next question was, in the investigation, it did not define a time frame, and so I was just wondering, is that something you're looking at? I don't, if there's a facility that's not complying. I don't want an investigation to drag out for 6 months. These things are continuously happening. So I don't know if I would bring an amendment, or maybe we could chat more offline, but I think I would definitely like to see some more parameters about if there is an investigation conducted, it needs to be done within a specific time frame so that we can continue to prevent this abuse from happening.
This is Max Carter for the record. And thank you, Assemblymember Gonzalez. And yes, I am open to that, and it's on the record now. We're going to be working with LCB and the Nevada Assisted Living Association to make sure we get this tailored right, and I'll make sure that that's part of what we're working on, to make sure, like I say, we want to get this right, and I appreciate the differing perspectives. Because as you can see here, from north to south, that everybody's situation is different, and we can't solve every situation, but we can try to capture as many as we can to protect our loved ones. So thank you.
Thank you so much. And then my last question, I appreciate it. Thank you so much, Chair. You were mentioning different current feeds, for example, doggy daycare, preschool, things like that. So are you envisioning that this is a feed that anyone can view? Are there specific parameters? Can you just talk about that a little bit more?
Thank you for your question. Max Carter for the record. No, they are not publicly available feeds, not live streamed. This is in somebody's personal space, and it's very narrowly defined, so it's private between the guardian or caregiver and the resident. So that needs to be private. I was talking about in the common areas. Thank you for the question.
Thank you for the clarification. Thank you so much, Chair.
Next, we have Assemblymember Koenig.
Thank you, Chair, and I remember this bill from last time. I'm pretty sure I voted for it. I think you touched mostly on my question here, but I just wanted to reconfirm that this will only be in the bedroom above their bed. I don't think it'll be in the bathroom to detect cold showers. It's not going to be in the common area where the potential fall and someone gets injured. It's just the bedrooms only, if I understand correctly.
Max Carter for the record. Yes, while we would like to take and try to cover as many potential danger zones as possible, we can't. And the reality is what you just defined. The bedroom is what is doable right now. So you're 100% right. You do remember correctly, and thank you.
Thank you. I would also like to clarify, before we move on, following up on Assemblymember Koenig's question. In Mr. Collins' situation, he lives in his own apartment. And so potentially there would be cameras in other areas that are not specific to his bedroom. Is that correct?
Max Carter for the record. Chairman Brown May, you know what, you bring up a point that I do need to look into, because you're right, because that space is 100% Andre's private space. So we got another thing to add in to talking about with LCB. And do you mind if I let Mrs. Stevenson make a comment?
Go ahead quickly. We do have a number of questions.
Peggy Stevenson again for the record. To this point also, when you sign up for extra help, and in all cases, my mother has an ensuite, and you pay rent for the space, and you pay additional money for additional care, and I can have cameras in my house wherever I want. That's her house. We should be able to put cameras wherever we want. And especially in my mom's case, she was taken advantage of in different facilities in her bathroom showering. One was, when her wedding ring and her mother's ring were taken. Another facility was the shower tortures. So my feeling is that it's her space. We can put cameras wherever we want in her space.
Thank you for that. We do have a comment from legal with regard to clarification. Thank you. Go ahead.
Thank you, Chair. David Noss, LCB Legal. For the record, again, in current law, NRS 449A.182 states that the patient or the representative of the patient may request the installation and use of the electric communication device in the living quarters of the patient. And then living quarters is defined in NRS 449A.176 to mean the room in which a patient resides.
Thank you. So I have a follow-up question relative to that. What if it's not actually a patient, but instead a resident?
David Noss, LCB Legal, for the record. That is a good question, and would be a policy determination for the committee and the legislature to determine based on revising the definitions to include more than just a room of a skilled nursing facility to what the living quarters would be. Alternatively, leaving the definition, it could be a regulation to be adopted to further define that term by the division.
Thank you for that clarification. Thank you. Next, we have Assemblymember Jackson.
Thank you, Chair. And I believe my concern was answered. I was just concerned about the HIPAA and privacy of the patients, but it believes my answer. I've been answered.
Thank you so much. Members, any other questions? Seeing none, at this time, we'll ask you to go ahead and step back. Thank you for your presentation. We will now open up testimony in support of Assembly Bill 368. As a reminder, please state and spell your name for the record. You will have 2 minutes. We will allot 20 minutes in total in support, opposition, and neutral. For anyone who is here to offer comments, you may begin when you are ready.
Good afternoon, Chair Brown-May and Vice Chair Wynn. My name is Kayla Maese, spelled Kaylah. Last name is Maese. I'm a civil rights analyst at the ACLU of Nevada, and we want to thank Assemblymember Carter and the courageous advocates for bringing forth their story today and having the heart to be able to share that with the legislature. Abuse of our most vulnerable community is a civil rights issue. We're very glad that this bill was brought forward, and we are looking forward to seeing it continue. Thank you very much.
Chair, members of the committee, Jonathan Norman, NORMAN, Nevada Coalition of Legal Service Providers. We represent a lot of folks in adult guardianship and also just generally, I think when a patient or a resident is consenting to having something for a designated loved one to view, to check in and care on them, to me that just makes common sense. And so I hope you support the bill. Thank you.
Thank you. Is there anyone else here in Carson City wishing to offer support testimony on this measure? Seeing none, we'll go down to Las Vegas. Please state and spell your name for the record. You may begin.
Good morning or afternoon, I guess. Carol Matrone, that's CarolMatrone for the record. Thanks for allowing this comment to be in record. My daughter, Maria Matrone, lives in close proximity to Andre. She's significantly impacted by cerebral palsy and is physically challenged, speaks on a communication device as well, and drives and motors around her community independently. Maria, when she first moved to her community, Betty's Village, requested cameras as well and was denied. So, I don't think I need to reiterate any more stories or any more things. The presenters in Carson pretty much hit a home run. Jody and Andre ran the bases for them. So, it is common sense. It's the right thing to do. It's kind of a no-brainer to allow cameras in those facilities that SB 368 will provide for. So thank you for your time.
Thank you. Seeing no one else in Las Vegas wishing to offer testimony at this time, AVH, is there anyone on the telephone lines who would like to offer support testimony for AB 368?
If you would like to testify in support of Assembly Bill 368, please press star 9 now to take your place in the queue.
Hi, my name is Katrin Ivanov, and I am very impressed to finally hear a bill that actually comes from the public and it reflects the public's wishes, and it the way it's written up and the way people are trying to write it is actually to help citizens, especially the most vulnerable ones, the adults and the nonverbal ones. So I am really, really happy to hear, because I listened through the 23rd session, the 25th session, and most of the time I have to testify and say, please use your common sense. So I'm very happy to finally hear a bill that uses common sense. Yes, some things need to be tweaked, but it looks like they will be tweaked in the right direction. So if someone wants to have, even an adult wants to have a camera on them for their own protection, and that's also for protection of the staff, because that adult may be falling on their own and having bruises, and then you can blame the staff for that. So that camera goes both ways. We have really good people that care for our elderly, and then we have bad ones. The good ones should have no problem with the cameras. That would only show how good they work with our elderly. The bad ones are the ones that should be scared, and the bad ones should not be moved from facility to facility to facility. I hope they add an amendment to the bill also to have the care people, some kind of a report on them. So when somebody is caring of your loved ones, you can see if these people actually are good or bad. Thank you so much again for listening to that bill, and I hope you vote yes on it. Thank you, and have a lovely day.
Chair, there are no other callers to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition testimony. Is there anyone here in opposition of Assembly Bill 368? Please come forward in Carson City and in Las Vegas. Seeing no movement. AVH, is there anyone on the telephone line in opposition of this measure?
The public line is open and working. There are no callers at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. Is there anyone here to offer testimony in neutral? Carson City, Las Vegas. Seeing no movement. AVH, is there anyone on the telephone line in neutral?
The public line is open and working. There are no callers at this time.
Thank you, AVH. At this time, we will welcome our bill sponsor back for any closing comments.
Thank you, Chair Brown May. This is Max Carter for the record. I just want to come up here and say thank you to these two families for trusting me, for trusting all of you to take and protect their loved ones. And I can't leave without, we hear all the time about how magical Betty's Village is. We're seeing it right here. The community that's built there is an amazing thing. These two families live across from each other. They both helped identify a problem, and they came down to try to fix it. And that's a wonderful thing. And I hope you find it in your hearts to support this bill. I do have several co-sponsors that will be added in when we do the amendment. And thank you so very much.
Thank you, Assemblyman Carter. At this time, we'll close the bill hearing on Assembly Bill 368. We'll move to our next item on the agenda, and we will open the bill hearing for Assembly Bill 350. We have our presenter in Las Vegas on this measure. Please take your time and get settled. You may begin when you are ready.
Good afternoon, Chair Brown May and members of the committee. For the record, my name is Attar Hasibullah, first name spelled A-T-H-A-R, last name H-A-S-E-E-B-U-L-L-A-H. I'm the Executive Director for the American Civil Liberties Union of Nevada. I'm here to present Assembly Bill 350. I did want to thank the Assembly Committee on Judiciary for carrying this as a committee bill. I will hope to keep this brief. I believe we have worked through all the kinks with counterparts on this. What this bill seeks to do is to provide more clear standards with what might happen during an exhumation or with respect to orderly conditions and maintenance at cemeteries. This is not a typical ACLU of Nevada bill. I will tell you that the reason why this bill came forward was because of a slew of our members and stakeholders who had complained about various conditions at different cemeteries that included both of these specific provisions. We have not worked on cemetery bills before, so opening up this section was very interesting, and learning more about the cemetery process has been interesting as well. I'll seek to go through each of the items that's listed as best as I can. I want to make sure that I leave ample time for any questions, but will be as brief as possible. I'll start by noting that we did provide a conceptual amendment that's been uploaded into Nellis. Wanted to thank Washoe County, Clark County, Lyon County, each of their respective health districts, few of the DA's offices, NACO, as well as Davis Cemetery for working with us on the language here. We think we got this to a place where there isn't additional objection to it. I suppose I'll find out here shortly during opposition testimony if there is any. But I'll go ahead and take you through what the actual bill would do. The amendment's actually more critical. And so while the bill speaks for itself, the amendment really lists out the criteria. The conceptual amendment that's been put forward lists a few different exceptions for when an exhumation may occur. And the specific exemptions that are listed are for a coroner that's acting in their official capacity, a public health officer who's also acting in their official capacity, and finally a family member of someone who's deceased that shows testamentary intent by the decedent to have their body moved. This process of exhumations is apparently a lot more common than we thought might exist. I don't have the exact number, but at least based on one cemetery's account, they have nearly 24 requests per year for exhumations to occur for a variety of reasons. We think this allows for a little bit more of a clear standard for what that looks like and who can move forward with seeking such an exhumation. It does require, as is specified within the conceptual amendment, documentary proof establishing those types of relationships, maintenance of documentation surrounding the exhumation, and a return to proper landscaping and orderly conditions as was previously existed before the exhumation occurred. Finally, subsection 5 of the bill, which is actually the maintenance piece, we've spelled out effectively what this will do is it'll modify the definition of orderly conditions to actually have standards associated with it. Right now, those are discretionary. They don't mean very much. But what this will do is it will require mowing and maintaining the grass at cemeteries on a monthly basis with an exemption if there is dormancy with respect to grass growth based on temperature conditions. It'll require regular removing of weeds and debris, trash that's actually at the cemetery grounds. It'll also require maintenance of pathways and entryways into the actual cemetery. Finally, it'll ensure that there's proper placement of tombstones, headstones, grave markers, and things of that nature. We did actually, there was a previous provision that was included within the bill that we specified and addressed within the amendment that does not require the county necessarily to impose fines per use. We didn't necessarily want to move forward in that direction. The main thing that we wanted to do was allow for families who have people who are buried at these locations to just have a set of rules that they know exist in place. And obviously, we deal with these issues on the back end when things come up. The district attorney's office is responsible in part for enforcement here, as was specified with respect to some of these items. But there's also, we have state oversight of these functions. It's just when you have a definition, when you have a term like orderly conditions that's poorly defined, it leaves a lot to be desired. So we think this goes a long ways. The families that we've worked with on this issue, and I think some of them submitted letters of support on this, but they were okay with this as well. And so that's the reason why we're involved. I'm happy to take any questions that the committee might have on this. But again, I think working out this arrangement with each of the various counties and the health districts, alongside the families that were involved, and Davis Cemetery as well, gave us a good baseline of understanding how these processes work. And the language was amenable from everyone we've talked to. for this to be able to move forward. But with that, I'm happy to answer any questions.
Thank you for your presentation, members. A question from Assemblymember Gray.
Thank you, Madam Chair. Now, this would not require family members to have loved ones exhumed, would they, if they are moving, say, from one cemetery to another cemetery?
So if someone's moving, sorry, for the record, Atar Hasibule, ACLU of Nevada. Chair Brown-May, if I can go directly to the member.
Please go direct.
Assemblymember Gray, so what this would do is it would require proof of documentary intent if the family was to request that. So for instance, if someone pops up with a family member that doesn't have any sort of testamentary intent, they say, I want to move this person, that wouldn't be permitted. But if somebody is specified and they have the ability to do that, they would be able to do that. Otherwise, it would require a court order. So the exemption is for the court order piece of it. As it stands right now, a court order is generally not required in most of these instances, but that's where some of these challenges arise from. So the exemptions I mentioned in the first portion of the presentation with respect to a coroner, public health official, or the family member that has documentary proof of testamentary intent to allow that person to be able to move their body or otherwise have input into that matter, they would not require a court order. For other items, though, a court order would be required.
Members, any other questions? Thank you. I do have one, if you don't mind, and you probably stated it briefly in your presentation. This is jurisdictional, comes to us from the Interim Committee on Judiciary. Do you recall where did this issue, what is the story that originated this issue for us to hear today?
For the record, Atar Hasibule, ACLU of Nevada, Chair Brown-May, without delving too deeply into this, because I don't want to create any sort of disparagement. Obviously, there's back and forth, but effectively, what we were advised was there was a Nevada-based cemetery that was not engaging in any kind of real maintenance at the facility or at the cemetery, I should say, with respect to grass conditions and things like that. There's also a complaint that we received that a family member of an individual that person's mother was moved without them being notified of such. Obviously, there was a back and forth on that, but one thing we looked at when we looked at the law, regardless of whether or not that ended up moving in any direction or not, one of the things we looked at was what the existing state of the law was, and we recognized when it came to orderly conditions that was left vague when it came to exhumation-related items. And I'm not an exhumation expert or cemetery attorney, so I'm probably not the foremost expert on the subject, but one of the things we did look at, just from a statutory construction standpoint, was the lack of clarity surrounding when these types of issues can occur. What was a bit odd about this was, for instance, we were not aware that there was, the significant number of exhumation requests that came in, and certainly it does raise questions, but we thought that, working with all the different local governments that are involved, a few of the cemeteries that are involved, as well as the families that we've spoken to, we thought this went a long way in addressing these issues.
Thank you for adding that and that clarification. Members, any other questions? Okay, seeing none, I'll ask you to, well, you can probably stay there. You can just step back. I'll open up testimony in support of Assembly Bill 350. If you are here in support of this measure, please come forward in Carson City or in Las Vegas. Okay, seeing no movement. AVH, is there anyone on the telephone lines in support of Assembly Bill 350? Oh, I have someone coming. Are you here in support? Sorry, AVH. I see movement in Las Vegas. If you're here in support, come on forward and, okay. AVH, go ahead.
The public line is open and working, and there are no callers at this time, Chair.
Thank you, AVH. If you are here in opposition of Assembly Bill 350, please come forward at this time. Thank you. State and spell your name for the record. You have 2 minutes.
Good afternoon, committee. My name is Selena DeLullo, CELENADILULLO. I'm the president of Palm Mortuaries and Cemeteries. We very much appreciate all the work that's been done on this bill. the revisions that were made to the disinterment portion, we very much support. However, we oppose the cemetery maintenance standards. They're subjective. They don't account for provisions of a natural disaster or drought and seem to be specific to private cemeteries only. We do support cemetery maintenance standards. Of course, we have those for all of our cemeteries. And the Nevada State Board of Funeral and Cemetery Services is actually the regulatory board for cemeteries. And while the maintenance rules are not written, they can be regulated by this board. Thank you.
Thank you. Is there anyone else who would like to offer testimony in opposition of Assembly Bill 350? Seeing no movement in Carson City or Las Vegas. AVH, is there anyone on the telephone line who would like to offer testimony in opposition of Assembly Bill 350?
The public line is open and working, and there are no callers at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. If you would like to offer testimony in neutral on Assembly Bill 350, please come forward at this time.
Good afternoon, Chair Brown May, members of the committee, Joanna Jacob on behalf of Clark County. And I guess you heard today that we worked with the ACLU proactively on this bill. And you heard we are here neutral with the bill as amended, because with the removal in particular of Section 2, subsection 2, which would have put the Board of County Commissioners really enforcing some of the standards that actually, as you heard from the previous testifier, really sits with the state agency and the regulatory board there. But it was a very proactive discussion involving all of NACO, Lyon County, everybody, the health districts. We worked and we pulled together the amendment that is before you. So thank you to the ACLU and everybody who worked on it, and we are neutral with the amendment. Thank you.
Thank you. Is there anyone else who would like to offer testimony in neutral on this measure? Seeing no movement here in Clark County or in Carson City, no movement in Las Vegas. AVH, is there anyone on the telephone line who would like to offer testimony in neutral?
The public line is open and working. There are no callers at this time.
Thank you, AVH. To our bill sponsor, you are welcome to offer some closing comments.
Yes, for the record, Atara Sibula. Just wanted to thank the committee for hearing this on a Friday afternoon. We did try to work with as many stakeholders as possible, make this as clear as possible, went back and forth about grass length requirements and things of that. We view this as probably the most flexible form of an amendment that we'd be able to move forward with without it being totally convoluted and having no teeth to it. As Assemblymember Carter noted in the previous bill hearing, sometimes the law is challenging. We don't want to have to keep coming back on these types of issues. I'd prefer not to work on a cemetery bill again during the pendency of my career if that was possible, but to the degree we're here today, this is the bill that we are offering, and we look forward. We'll also have a follow-up conversation with POM and see if there's anything else we can do to assuage those concerns. But did want to thank this committee and always happy to answer any additional questions off the record should those questions arise. Thank you again.
Thank you. With that, we'll officially close the bill hearing on Assembly Bill 350. Members, that moves us into our last order of business, which is public comment for today. To provide public comment, anyone here would like to offer public comment in Carson City, please come forward at this time. In Las Vegas, to provide public comment or testimony telephonically, dial 888-475-4499. And then on the meeting ID, when prompted, provide 898-149-28868, and then press the pound sign. Seeing no one here in Carson City wishing to offer public comment at this time and no one in Las Vegas, AVH, is there anyone on the telephone line who would like to offer public comment?
The public line is open and working, and there are no callers to offer public comment at this time.
Thank you, AVH. Members, is there anything outstanding before we adjourn today? Seeing no comments, thank you so much for a really great week. We look forward to seeing you on Monday. This meeting is adjourned.